Welcome! The clinical image in this explainer is provided with full credit to Dr. Mohammed Al-Nagi Mohammed. So, what are we diving into today? This is a clinician's guide to Pityriasis Versicolor. Our goal here is to do a focused clinical review, really aiming to sharpen those key diagnostic and management skills that are so essential in our day-to-day practice. Okay, let's jump right into a clinical scenario. Your patient walks in, and this is what you see on their trunk. Take a close look. Multiple hypopigmented and some erythematous patches. So, what's jumping to the top of your differential diagnosis? This classic presentation should really make one condition pop into your head almost immediately.
All right, here's how we're going to break it down. We'll start with the definition and what causes it. Then, we'll cover how to recognize it clinically, look at the predisposing factors, and wrap up with a solid management pathway.
So, first up, definition and etiology. Let's get down to the fundamentals of what this superficial fungal infection really is. Okay, so the official term is Pityriasis Versicolor, but you'll also hear it called Tinea versicolor. At its core, it's a superficial fungal infection of the skin. And the culprit? It's a yeast called Malassezia furfur. You might remember it by its old name, Pittosporum ovale. Now, what's interesting is that this organism is actually a normal part of our skin's flora, a commensal. The problem starts when certain triggers cause it to switch over to its pathogenic or disease-causing hyphal form. All right, we know it causes it. Now, how does that translate to what we see in the clinic? Let's talk about clinical recognition, what you really need to look for. The features are pretty classic once you know them. First, think about distribution. It almost always hits the trunk. The patches themselves can vary in color. You'll see hypopigmented, pink, or even brown lesions. A fine scale is pretty common, and patients might complain of some mild itching. Now, here's a huge clinical clue. It often becomes way more noticeable after a suntan. Why? Well, the fungus produces something called azelaic acid, and that acid actually inhibits melanin production, so the affected spots don't tan, creating a really stark contrast with the surrounding skin. And that variability is baked right into the name. Versicolor literally points to the different colors the lesions can have. It's a great little memory aid when you're in the clinic. So, that leads to a pretty important question. If this yeast is just hanging out on our skin normally, what makes it suddenly decide to cause a problem? Let's dig into the predisposing factors. The question we need to be able to answer for our patients and for ourselves is, who is most at risk? Now, what's interesting is that Pityriasis versicolor can and often does pop up in perfectly healthy people. But there are definitely factors that create a more welcoming environment for the yeast to overgrow. Things like warm, humid climates are a big one. And then there are host-specific factors, right? We're talking about things like immunosuppression, malnutrition, or any condition with excess corticosteroids, think Cushing syndrome, or even just from taking steroid medications. Okay, we've got the diagnosis and the risk factors down. Now for the practical part, the management pathway. Let's walk through a stepwise, evidence-based approach to treatment. When we're talking about a first-line approach, it's always good to look at the guidelines. The UK's National Institute for Health and Care Excellence, NICE, has a very practical recommendation here. They advise using ketoconazole shampoo, and the reason they give is really important for real-world practice. It's simply more cost-effective when you're treating large areas like the trunk. So let's lay out the treatment pathway step by step. Step 1, you start with a topical antifungal, like that ketoconazole shampoo we just mentioned. Now, what if there's no response? That brings us to step 2. You've got to take a step back and reconsider the diagnosis. To find out for sure, we move to step 3, confirm it. You can do this by sending skin scrapings for mycology. Under the microscope, you're looking for that classic spaghetti and meatballs pattern of hyphae and spores. And finally, if the case is really widespread or just not responding, that's when you escalate. Step 4 is to consider an oral therapy, like itraconazole. So, to wrap it all up, what's the big takeaway here? Pityriasis versicolor is common. It's usually easy to identify just by looking at it. And thankfully, it's highly treatable with our standard antifungal therapies. And I'll leave you with a final thought for your practice. Once you've successfully treated the infection, how do you counsel your patient? You need to talk about the high chance of it coming back, and maybe even more importantly, manage their expectations about the pigmentary changes. Those spots can take weeks, sometimes months, to return to normal, long after the fungus is gone. That conversation right there is a really critical final step in managing this condition effectively.